Hi everyone, it's Lyndsey and Tom again. Today we'll be talking about endometriosis. So what exactly is it? So it's basically a condition where the tissues, which are similar to those that line your womb, they begin to grow in other places. So it can grow in kind of the ovaries or around the kind of fallopian tube. So basically anywhere kind of around the ovary area. So it affects about 1 in 10 people. And it's basically where cells like the ones in the lining of the womb are found elsewhere in your body. So each month, basically, when our cells react in the womb, they basically build up and then you have a period. So they break down. And if you don't become pregnant, you begin to bleed. But this process happens elsewhere. And because it happens elsewhere, it basically means that the blood can't go anywhere. So obviously in your womb, it comes out of you. But in these other areas, it has nowhere to go. So it basically builds up and it's stuck there. So what are the symptoms? So basically anyone of kind of productive age can get these symptoms and kind of get this condition. So the kind of things you could get are really kind of chronic pelvic pain, period kind of pain, so the kind of really strong pains which can kind of affect your daily activities and even your quality of life, but if it's kind of very severe. You can get kind of pain, really kind of deep pains during sexual intercourse, and also kind of painful bowel movements. So it really kind of does affect that kind of lower part of your body. You can also kind of get period related or kind of cyclonic urinary symptoms, so kind of blood in your urine or kind of struggling to pass urine, so a lot of pain there. And in kind of severe cases it can also cause kind of infertility, but you will kind of get these other symptoms in conjunction with that. So what are the causes? So there's a lot of kind of theories out there, not all of which are proven. Many kind of have strong evidence behind them. So first one is genetics. So obviously if someone in your family has it, it kind of tends to run in families. And it can also kind of affect certain ethnic groups, so some more than others. You can also get what's called retrograde menstruation. So when some of the womb lining flows up through these fallopian tubes, it embeds itself on the organs of the pelvis rather than leaving the body. And in those cases, you're more likely to get it. If you have problems with your immune system, again, this means your body's natural defence is kind of a lot weaker. So you're a lot more prone to kind of illnesses and infections. Again, when these kind of endometrium cells spread through the body, through the bloodstream, this is when you're more likely to get it. There is also some thought that environmental toxins can cause it, but again, not proven. And then you also have metaplasia, which is where one type of cell changes or basically morphs into a different kind of cell. And basically these are the cells that kind of increase that risk. So how is it diagnosed, Tom?
Thanks, Lyndsey. There's a couple of ways that it can be diagnosed, but it is very, very difficult because the symptoms can vary considerably, and they do tend to sort of show you different conditions, which are very, very similar in different conditions as well. So for a GP, it can sometimes be relatively hard to diagnose it, but your GP will usually go through your symptoms with you. They potentially could do a laparoscopy, which will be further investigation to essentially put a camera down into the pelvis and see, more closer to the navel and see whether they can see anything. Surgeon usually uses this camera to see. They'll make a sort of a small cut near the pelvis, and they'll see any signs of endometriosis within that. And if it is diagnosed, and endometriosis may be treated or removed for further examination during that laparoscopy. These are the different stages of endometriosis. You can see, obviously, stage 1 to stage 4, and you can see, really see the different the growths in and around the different areas there.
So once you've been diagnosed, how can it be then treated?
So currently, unfortunately, there isn't a cure for endometriosis. The different treatments are available for endometriosis, aimed to reduce the severity of the symptoms, so make sure that you're improving your quality of life and just really kind of longing and getting rid of the pains, getting rid of anything that might cause you discomfort. But the treatments can be given usually to relieve the pain, as it says, to slow the growth of the tissue from endometriosis and improve fertility or stop the condition actually returning. Got some more treatment options as well. Here again, painkillers, ibuprofen, paracetamol, any forms of hormone medicines or contraceptions, contraceptive pills, patches, any form of IUS, which is the inter-uterine system, and the medicines accordingly, any hormones, surgery to cut away the patches of endometriosis of the tissue, and depending on obviously the age, you can have a form of the actual womb removed, which is called a hysterectomy. But usually this is only done in severe cases, and if it's causing a lot of pain, usually this is done in elder women, purely because obviously if you have your womb removed, you will usually be infertile.
So like you said, there's no cure for it. So what's it like for people living with it, and how can they cope with this?
Absolutely, yeah. So obviously it can be very difficult physically and emotionally to deal with this kind of stuff. Your GP will help you along the way, of course, and there are lots of different forums and support groups which are linked on here as well. So if you ever want to go onto them, just you have access to this and you can click on and have a little look. But you've got Endometriosis UK for information, advice, and the directory of local support groups as well, and helpline, which you are able to call whenever you like, which will be essentially an online community for all the women who are affected by this condition. So you can speak to people who are in your similar position and going through exactly what you're going through, to really kind of help you get along. And of course, this combined with all the treatment options that we can, the GP will provide for you as well, will help, of course. That is pretty much it. We've got a video here for anyone who would like to watch it. About 3 minutes long, really kind of explains what endometriosis really is and how it occurs. Again, the treatment options and everything sort of summarised in this video. So please take time if you are concerned. Please take time to just have a little look at this. Won't take too much time out of your day, but it really is informative. And that is it.
Perfect. Thanks for that, Tom.